Hello and welcome to Media7. Medicine and the public interest have been prominent in the news this week, as they are most weeks. A High Court review of the way our abortion laws are administered, a qualified change of mind by the US FDA on mercury amalgam fillings, and in oddly underreported news, a Victoria University biologist is about to present research on the potential cancer-fighting qualities of a chemical derived from New Zealand sea sponges. All those stories present distinct challenges to the news media, not least because the reporting of health, an issue for everyone, quite often looks a bit like this. Dodgy doctors, malign midwives, miracle drugs and who gets them, miracle cures that really aren't, bogus remedies, drugs that allegedly don't work, pandemics that don't turn up, the odd unfortunate experiment, and the public health system itself, where seldom is heard an encouraging word, in the media anyway. Joining me to talk about how well the news media report health and medicine and whether they could do better are Ray Lamb, a health correspondent who jumped the fence and became the Deputy Health and Disability Commissioner, 3 News' Dr Lillian Ing, that rare thing, a health reporter who is also a medical doctor, and former Auckland District Health Board Chair Wayne Brown. Perhaps we could actually look at some of the historical stories that we had there in that montage, and let's start with the mother of all health stories, the unfortunate experiment. How did that change things for health reporting, Ray?
Well, I mean, you have to say it changed things for the health system. It's a fine example, and it stands out amongst those other examples that you gave as being a story which really demonstrates that the media have a very valuable role as agents for change. I mean, it was that reporting in the Metro magazine all those years ago which led to massive change in terms of the health system, the cervical screening, massive change in terms of, recognising people's rights to informed consent, and in fact the setting up of the office that I now work for, the Health and Disability Commissioner. So I think it was a very important example of an instance where journalists, in this case Sandra Coney and Phillida Bunkle for Metro magazine, got it right. And more recently we have another example, again women's health, again cervical cancer screening, and that was the case several years ago in Gisborne, the Gisborne Cervical Screening Inquiry, which again has led to further change. And that was a case where a patient who had had some misread smears spent about 4 years trying to go through the system, raising her concerns not only about what happened to her, but she thought that other women had been affected. Now, that story was not picked up for 4 years until a reporter from the New Zealand Herald covered the fact that the patient had gone to the High Court and lost her case. And
that wasn't a health reporter on the Herald story either, was it?
It wasn't. It was a general reporter, as I understand it, who picked it up. It wasn't a big story. It was a little sort of 4 or 5 column piece buried inside the Herald. As I say, this woman had been fighting for 4 years to have her complaint recognised and the issues looked at. Following that story, of course, we know from history that all sorts of things happened, and there was a massive inquiry. Thousands of women had their smears reread, and it was discovered that this woman's concerns were right. There were other women who had been affected. So, again, fine example of some very good reporting that led to some positive change for people.
Lillian, this is your round, and you are a doctor. Do you think those big investigative stories changed the way that you can do your job?
Well, certainly. I mean, I spoke to Sandra Coney just recently when Otago University reanalysed the data from the unfortunate experiment. And what she really impressed upon me was just the sea change in attitudes, and that so much has changed since then with the cervical screening program, with the Health and Disability Commissioner, and yet doctors still think that there are still some doctors that are around today that refuse to believe that it ever happened. So, in a way, I think the media has a very valuable role in that sense, because with that story, I was able to introduce that story to a whole generation of X and Y who didn't even remember that, and I think that institutional memory is very, very important for health issues in New Zealand.
It's interesting you said there are still some doctors who won't accept that story was valid. There was a backlash in the magazine that published it. I mean, you've had some harsh words to say about doctors in your time, Wayne.
Oh, I think that's been overplayed, really. I've worked well with many senior doctors, and one of the things that disturbs me is that the media don't immediately go to the clinical directors of hospitals for their first
So they're going to the wrong people?
Well, they generally go to people that they've had a relationship who they know are going to say something controversial, rather than going to the clinical director of that service. And that person will be knowledgeable about that specific thing and understanding of what's going on, and more than likely will be a full-time employee of that hospital board, because health is awash with conflicts. People who are part-time in and part-time in private. And
that must have been an issue for both of you two in reporting as well, is that you can't just go and talk to one person on the health story. It's not that sort of sector. You actually need, it's like going and getting a medical opinion. You actually need to get several opinions on the story, don't you?
And that's the difficulty, I think, too often. We talked about some spectacular successes. There have also been, as you highlighted at the beginning of this program, some spectacular failures where there have been, when New Zealand health journalists get it wrong, they get it wrong very, very badly. And fortunately, most of the time, they get it right. But if you look at those instances where the public have been done a disservice, such as the Lipronol story and others, it's often because not enough time is spent on researching the story, the right questions aren't asked. One of the key questions journalists need to ask in those types of stories is, where's the money? Where's the money coming from? And also, questions around who is going to be benefit or be harmed by this story. Those sorts of things don't often get considered. So it's time, it's competition, which can drive it. Lipronol was a prime example where the Herald and Television New Zealand were vying to be first with the story, and as I understand it, it broke when it did because one organisation got wind that the other was going to break it. So again, not as well considered as it could have been. So time, competition, and really not canvassing enough of the opinion, not giving enough of a balance to the issue that they're covering.
Just before we go to the break, there's another genre that's become incredibly popular in all forms of the news media in the past few years, and that's the dodgy doctor story. Usually a foreigner. It's got great emotional impact because you've got a victim. Does that actually make the job that you do now harder in actually trying... You're head of complaints resolution. Does the media racing out and doing those wham-bam stories actually make your job harder?
It's interesting because if you're covering medical errors, medical misadventure, the things that go wrong, and they do, and I see them every day, and I will quickly add that they tend to be the exception rather than the rule, I think that it's very easy to do a story that blames someone. I mean, it's very easy for a journalist to see things in black and white terms, have a victim, find the person responsible. Fortunately, what I think you're starting to see is a bit more sophistication, and I think you have seen a change in the last few years in reporting of medical error stories, and there are fewer stories that simply try to blame an individual, and there are more stories that recognise that it's much more complex than that, and often the individual is the last person in the chain of events that led to what happened. So I think it is getting more sophisticated.
Writing the story without the bad guy.
Well, I mean, sometimes there is a bad guy and it has to be there, but I think there is more recognition by health journalists in this country and overseas that is almost a lazy way of doing it, that it's not that simple most of the time.
And I think the public also recognise that there's a wide range of competencies within the medical profession, and in the same way that you might choose a second opinion, there are also a wide range of competencies with journalists, with public relations people, with press secretaries in Parliament.